If every spring or at the beginning of summer your eyes start to itch, become red, watery, and you feel the constant urge to rub them, like many people, you might think it is just a cold or dust irritation. But these symptoms are very often a sign of eye allergy. And this is not just temporary discomfort, it is an inflammatory condition of the eye that, if ignored, can lead to long-lasting complications. What do we mean by eye allergy? It is an allergic reaction of the outer surface of the eye, the conjunctiva. Simply put, when allergens from the environment land on the eye's surface, the immune system treats them as a threat and overreacts. As a result, redness, itching, tearing and swelling appear. What can act as allergens? The most common cause is pollen, especially in spring when trees bloom, and in summer when grasses release pollen. Household dust is another very frequent trigger. Dust in carpets, soft furniture, pillows and bedding contains microscopic particles that can provoke allergies. Animal dander is also a common cause. Sometimes cosmetics, creams, hairsprays, perfumes and even eye makeup products can trigger allergic reactions. In some people, contact lenses or lens solutions may also cause allergy. Does eye allergy always look the same? No, there are different types. The most common is seasonal allergic conjunctivitis. It appears at a specific time of the year. A person notices that every year around the same season the itching begins. Many say, as soon as spring comes, my eyes turn red. There is also a perennial, year-round type, usually caused by indoor allergens such as dust or pet dander. In addition, there are allergic reactions related to contact lens wear. The main symptom of eye allergy is itching. This is often what distinguishes allergy from infection. The urge to rub the eyes becomes very strong, and this is where the biggest mistake happens. Rubbing the eyes makes the allergic reaction worse. When you rub them, the surface becomes even more irritated. Blood vessels expand, redness increases, and inflammation intensifies. In some cases, excessive rubbing can even damage the cornea. This is especially dangerous in children because they cannot easily control the urge. The second symptom is redness. The white part of the eye turns pink or red. This can alarm people and many immediately look for antibiotic drops. But antibiotics are usually unnecessary in allergy because allergy is not an infection. It is an immune reaction. The third symptom is tearing. In allergic reactions, the eyes produce more tears as if trying to wash away the irritant. But these tears do not solve the problem. They only provide temporary relief. When someone says, "My eyes are constantly watering," it does not mean the eye is functioning well. It is a sign of inflammation. Swelling is also common. The eyelids may become slightly puffy, and there may be a feeling of heaviness around the eyes. Light sensitivity can increase. By evening, fatigue becomes more noticeable. Sometimes vision temporarily feels blurry because the tear film is disrupted. An important question is, how can you distinguish allergy from infection? First, itching is much more intense in allergy. In infection, pain, burning or sharp discomfort may be more prominent. Second, allergy usually affects both eyes at the same time, while infection may begin in one eye. Third, allergy is often accompanied by other allergic symptoms, such as sneezing, nasal congestion, or throat itching. However, the safest way to know for sure is to have your eyes examined, because sometimes both conditions can coexist. Another common mistake is prolonged use of redness relief drops. These drops may temporarily make the eyes look whiter, but they do not treat inflammation. With long-term use, they can damage blood vessels, worsen dryness, and harm the surface of the eye. Using random drops without medical guidance is also not correct. Allergy medications differ. Some block allergic reactions, some reduce inflammation, others protect the eye surface. The right choice depends on the severity of symptoms and the condition of the eye. Simply using something that helps often prolongs the problem instead of solving it. What happens if eye allergy is not treated? First, it can become chronic. A person experiences the same symptoms every season. Second, persistent inflammation can worsen dry eye syndrome. Third, the eye surface becomes more vulnerable and small corneal injuries may develop. This increases the risk of infection. In other words, untreated allergy can open the door to additional complications. What can you do at home? The most important step is reducing contact with allergens. During high pollen seasons, avoid keeping windows open for long periods. Wash your face after coming from outside. Clean the eyes gently without rubbing, and increase wet cleaning at home. Air conditioners may dry the air, so monitoring humidity is important. Contact lens wearers may need to consider taking a temporary break during severe allergy periods. However, the most reliable solution is to consult an eye specialist. Eye allergy may seem mild, but its severity varies from person to person. At Ko'z Nuri Clinic, we do not rely on a superficial check. We evaluate the conjunctiva, tear film stability, dryness level, and, if necessary, perform additional tests. Only then do we select individualized treatment. For some patients, protective measures and anti-allergic drops are sufficient. For others, inflammation control or dry eye treatment is also required. If every spring you experience itching, redness, and tearing, write in the comments which season makes it worse and what bothers you the most: itching, redness, or tearing. Also mention whether you wear contact lenses. We read the comments at Ko'z Nuri and will guide you on what type of examination may be needed. If the problem repeats every year or lasts for a long time, do not continue to suffer. Visit Ko'z Nuri Clinic. With accurate diagnosis and proper treatment, eye allergy can be controlled, the eye surface can be protected, and most importantly, you can eliminate ongoing discomfort from your life. Do not rub your eyes. The eye is a delicate organ. If you protect it in time, it will serve you for many years.